One second.
Can you start about here?
Okay.
I'll just go down right beside you. Who was in front? You were in front, right? Okay. So, 1 second. Come up and come up at your arm.
Chris, get over there for a second. Just stand beside them all first. 1 second.
Yep. I'm going to do this just 1 more time. I don't know if you guys ever acted before.
Martin, didn't you do it right yet?
Okay, you go for it, guys.
Okay, here we go.
Kristopher, welcome to Part Night. Thanks, everyone. Okay, you good?
Thank you.
And it's because my liver's backed up and it's really flowing the wrong way and causing me various veins. So I have to go in with the tube and they band the various veins, and then in about 2 to 3 weeks they fall off. And I've had that done for about a year now, and I've had 42 bands put in.
Wow. So how does it affect your life? How has it affected your life? What can you do? Like, how is it affected your life?
The first thing I can't do is sports. Can't do any sports. When I'm mostly in the hospital all the time, so I can't see my friends that often. I can't see my grandparents and my aunts and my uncles because they're so far away from the hospital. And I just hate it. I can't wait. I want to hurry up and get it so I can play my sports.
Did you play hockey?
I used to play hockey and soccer and all
Wherever you sit up here, make sure that you're nice to the other reporters.
Oh, yeah.
You know, if they're in your way.
Oh, yeah, I know. I'll only lay them over to the outside.
That's why if you sit up now, then we can go on.
Where are we? Right here? Are we allowed to be here?
We are prepared to start lunch service. Thank you. Enjoy your lunch.
be seated. We're going to begin, and the minister will make his remarks at 12:30. So enjoy your lunch and meeting. Special gathering. You see some new faces in the room today. The Economic Club of Toronto, by way of background, is Canada's leading public affairs forum. We are the platform of choice for many of Canada's policymakers and business leaders who come to make important speeches and policy announcements. Just by way of example, we were the forum that U.S. Ambassador Paul Cellucci used to make his infamous comments about the state of Canada-U.S. relations last March after America went to war in Iraq. We were the forum chosen by Premier Dalton McGuinty after his election in October of last year. The Honourable Greg Cervera has also chosen our platform. He was first public address with us. And Rick Waugh, just recently the new CEO of Scotiabank, made his first public address with us. So we are the platform of choice, like I said, by Canada's policymakers. And today we are pleased to have with us the Honourable George Smitherman, Ontario's new Minister of Health and Long-Term Care. The Minister, last time you were with us, you were in the audience, not as a speaker. And I remember, I guess it was about a year ago now, you came to one of our events on your own, and rather unassumingly, you entered the room, and you can say, really, what a difference a year makes. On October the 2nd, Ontario voted for change. Today, in this far-reaching and important address, Minister Smitherman will outline the new government's values, ideas, and plans for the province's healthcare system to make Ontarians the healthiest of all Canadians. Ladies and gentlemen, it is my great pleasure to introduce Ontario's new Minister of Health and Long-Term Care, the Honourable George Smitherman.
Thank you very much, Mark. It's a real honor and a pleasure to have a chance to be here today and joined by many people. Thank you very much, Mark. It's a real honor and a pleasure to have a chance to be here today and joined by many people who today make their lives in politics or have in the past that I'd just like to pay tribute to. My colleague in Cabinet, the Honourable Marie Boutriani. Peter Fonseca, my parliamentary assistant, has gone back to Public Accounts Committee but was with us for the meal. Sounds a bit more like a strategy I'd be inclined to employ. Deb Matthews from London is a great and long-time friend, an MPP, and now the president of the Ontario Liberal Party. Dr. Shafiq Qadri from my home turf of Etobicoke. My friend David Zimmer, all part of our new government at Queen's Park. Two members of a past government at Queen's Park that I had the honor of working for, Gilles Morin, a distinguished MPP from Ottawa, and Charles Beer, who has distinction that goes well beyond his term as an MPP because he's now serving as my executive assistant, and I think that's a very distinguished role indeed. But you know, frankly speaking, Charles might have a different point of view. I'd also like to pay particular tribute to Barbara Hall, who sits alongside the podium. They use the word community a lot, and there is no one person that's taught me more about community than Barbara Hall. I'm very honored, Barbara, that you're here today. I'd like to thank the Economic Club of Toronto for hosting today's luncheon, and I'm truly pleased to have the opportunity to speak about my favorite topic, which is healthcare, in an economic context. And I say this not just because at $28 billion, healthcare is an important sector of our economy, employing hundreds of thousands of people and acting as a major purchaser of goods and services, but because healthcare also brings an important economic advantage to Canadian employers, saving them billions more in insurance premiums while greatly enhancing our province's productivity. But even more importantly, Medicare, our system of publicly funded healthcare, is the very best expression of Canadian values. It is these values that fuel our determination to improve healthcare and put it on a sustainable path to the benefit of future generations of Ontarians. Like you, Premier Dalton McGuinty and his government believe in Medicare. We believe in it so strongly, in fact, that one of the first bills we introduced, the Commitment to the Future of Medicare Act, that bill provides enduring protection for publicly funded universal health care in this province. Now, there are obvious pressures on our system: an aging and growing population, demand for access to new technology, and emerging public health threats from an increasingly connected world. While some of these costs can be managed, costs that rise beyond the rates of economic growth over the long term are clearly unsustainable. The challenges are enormous. Of this I have no doubt. The pressure to produce meaningful results can be daunting, but it's also tremendously exciting and fantastically rewarding. And because we're talking about healthcare, I know that we have the full support of 12 million Ontarians. Today, ladies and gentlemen, I'd like to share with you some of the reasons that I'm so excited to have this job at such a crucial juncture in the life of our healthcare system. This is a remarkable time for Ontario and for healthcare. Over the last few years, our healthcare system has faced significant challenges, and it has undergone tremendous scrutiny. Review after review, study after study, have only served to reinforce the notion that universal, single-payer, publicly funded healthcare continues to be the right way forward. But they also concluded within that framework, major reform is required. None have spoken on that subject as loudly and as clearly as Roy Romano. And as we embark down a path of change, I feel a sense of good fortune that his thoughtful report provides us with a clear roadmap to guide us. I know that there are many people in this room who agree with me. They believe that Medicare is worth preserving, that it can be preserved. And when I look around, I see such a fine selection of the people who I have been so gratified to meet in the short time since my appointment as Health Minister. They give so much of themselves each and every day in the name of our health care, on behalf of you and me and our families. I call these people my healthcare heroes, and a few of them I'd like to single out for you today. Louise Binder, who sits there in red, is a passionate voice from Voices of Positive Women, someone I've known for so long. Carol Miller from Stratford is someone that I met more recently, a breast cancer survivor. She's shown leadership in helping to raise hundreds of thousands of dollars, but way more importantly, give people an emotional outlet for their remembrances of people who have fought breast cancer through a quilt project. Dr. Philip Berger, a man who has an extraordinary strong reputation for making hospitals connect and be relevant to really diverse communities. Dr. Alan Hudson, who has provided exemplary leadership across such an amazing diversity of roles in our healthcare system. And my newest healthcare hero is Kristopher Knowles. Kristopher Knowles came today from Kingston, but he makes his home in Sarnia. Kristopher's 13. Kristopher needs a liver. He's had 20 operations, and right now he's embarked on an Ontario-wide and hopefully a Canadian-wide tour designed to enhance the understanding and to promote the idea that there is something all of us can do. There is one thing that all of us can do, those of us who want to contribute to the sustainability of Medicare, built on our best values, and that's to sign a donor card, to make the ultimate sacrifice, to make the gift of life to others. Kristopher Knowles is my healthcare hero. I've invited a number of other special guests today that reflect the diversity of our system. Sitting around the tables in front of me are representatives from community groups, places like the Regent Park Community Health Center and like St. Jude's. From health providers, consumers, and government. There are health policy leaders and researchers, and of course some of my healthcare heroes that I've mentioned, the agents of change and beacons of hope in our system. They have infused in me a real sense of hope and optimism for the future. They have shown me that there are real opportunities for positive change all around us, opportunities for us to seize. I declare the time for talking about reform over. People voted for real positive change. Now it's time to deliver. I think it's strange, but when I was first appointed as Minister of Health, the first thing most people asked me was, "Are you scared?" This was a question rooted in the belief that the challenges we face in healthcare are enormous, and that they are too big for any one person to resolve. And obviously it's true. There are enormous challenges, and they are too big for just one person to fix. But there are ways to confront these challenges head on. Solutions that require not just the labor of one, but the determined effort of all of us. Public health care deserves no less. Everyone in this room today knows all too well that the challenges are great and that the signs of strain are undeniable. But many of us also know that we have a very good foundation on which to build, and that the task at hand is full of opportunity. The McGuinty government has already taken some substantial steps to seize those opportunities. We've moved quickly to redefine our relationship with the federal government on the basis of cooperation, and we've played a key role in ensuring the establishment of the National Health Council. We appointed Dr. Sheila Basler as Ontario's Chief Medical Officer of Health, and now all Ontarians will benefit from her remarkable abilities as she leads us in the renewal of public health in our province. When a Toronto hospital discovered a problem with the sterilization of medical equipment, I directed all hospitals to conduct an audit of infection control practices, a process that brought cultural change to hospital. And I'd like to applaud those hospitals and the work of the Ontario Hospital Association, represented today by Tony Dagnoni and Hilary Short. We did good work together. We've taken decisive actions to protect our seniors in long-term care facilities by conducting unannounced annual inspections. And today, my parliamentary assistant, Monique Smith, is conducting a top-to-bottom review of long-term care to make the system more transparent and responsive to the needs of our seniors. Premier McGuinty and I are committed to restoring the foundations of nursing, foundations that have been chipped away over time, because we believe that nurses are at the heart of the healthcare system. We targeted some of the federal diagnostic and medical equipment funding to purchase safety equipment in our hospitals, such as ceiling-mounted bed lifts. This is the first of a long-term strategy to invest in better working conditions for nurses. And we've challenged hospitals to convert overtime dollars into full-time opportunities for Ontario's nurses. Last but not least, we introduced two cornerstone bills that set the stage for transplant. Bill 31, the Health Information Protection Act, received first reading and has gone through extensive hearings through the committee process. Bill 31 would, for the first time ever in Ontario, provide broad legislative protections for the privacy, confidentiality, and security of personal health information. And it helps ensure that the information is used judiciously to improve health care and facilitate system change. Bill 8, the Commitment to the Future of Medicare, preserves in law the right of all Ontarians to access health care services based on need, not on ability to pay. It introduces tough prohibitions against two-tier medicine, requires mandatory reporting of practices like queue jumping and extra billing, and offers whistleblower protection so that these activities can be stopped. Furthermore, Bill 8 will help to usher in a new era of accountability in healthcare. As we move forward with improving our healthcare system, the Commitment to the Future of Medicare Act represents an important signal to Ontarians that the significant changes to come rest on a strong foundation of familiar values. while others might suggest that the only way forward is to abandon these principles and to throw up our hands and surrender, we will prove that health reform can and must be consistent with these values. The Romano report has set out in clear and compelling terms what our healthcare system needs. It's time to take the necessary steps to get us there. So what will a revitalized healthcare system look like? Well, frankly, it's going to look a lot more like a system. Services will be better integrated amongst the various providers that deliver them and will be modeled with the consumer's interest in mind first and foremost. I often say that when I look at the healthcare system, I don't really see a system at all. It's fair to say that many Ontarians don't experience a healthcare system either. Our vision is to build a true system, one that's integrated and driven by one common cause, to deliver the highest quality outcomes for our people. Our vision is of a system where all providers speak to one another in the same language, where there are no longer impenetrable and artificial walls between stakeholders and services, a system driven by the needs of patients, not providers. Accountability is the watchword of our renewed healthcare system. Let me be clear. By accountability, our government means that we share a responsibility with providers to deliver quality outcomes to our most important stakeholder, the 12 million people of Ontario. They're counting on us. They're counting on us to deliver results, so we must set priorities, because we believe that if you have 100 priorities, you really have none. Our government has 3 key priorities that we will be measured against. Number 1, reducing wait times for important procedures. For example, cardiac care, cancer care, and hip and knee replacements. Number 2, by improving access to family physicians and other members of the primary health care team. And number 3, making Ontarians healthier, a priority that will be measured by the rates of physical activity, smoking, and obesity. To achieve these priorities, some very fundamental changes will be necessary. There are 4 change strategies that we will initiate over the next year that I'd like to highlight to you today. Number 1, placing hospitals on a sustainable financial footing. Number 2, creating a culture of accountability and improved outcomes. Number 3, creating strong community healthcare services. And number 4, a new emphasis on healthy living, prevention, and health promotion. In each of these areas, fundamental change is necessary. I see these reforms as complementary, and I see these reforms as absolutely crucial. Let me start by talking about hospital funding, with change in our hospitals. Over the last few years, hospital funding has been growing at an alarming rate in the range of 10% per year. And while part of this can be explained by a growing and aging population, these kinds of increases are simply not sustainable over the long term. Furthermore, because hospital funding is the single greatest line item in the provincial budget, our inability to rein this in poses a threat to our healthcare objectives. I don't know if there's a simpler way or a nicer way to say this, but it just cannot go on. It simply is not sustainable. I'm not saying that hospital budgets cannot grow. They can and they will, but they cannot grow the way they've grown in the past. Let me be absolutely clear. Let me be absolutely clear. The days of double-digit increases in hospital funding are over. Hospitals are like the anchors on our healthcare tug-of-war team. In the coming days, our hospitals will be called upon to take up a dynamic challenge, to improve performance within an environment of stable yet restrained growth. I recognize the challenges that this will pose to a hospital sector that has become accustomed to getting huge budget increases each and every year. But hospitals will not be asked to face this challenge alone. They will be assisted by our transformation agenda that at its core will reduce growing demand on the services that they provide. Hospital funding must be more stable and predictable, and spending needs to be aimed at achieving results. Let me tell you what I mean by that. For too many years now, government and hospitals have allowed a culture to develop in which many of our province's hospitals continually run annual deficits. And at the end of the fiscal year, the Ministry of Health faithfully bails them out. What's more, hospitals have been allowed to Hospitals have been allowed to accumulate large working fund deficits, made up in part by unpaid operating bills from previous years. Servicing that debt is costing hospitals millions and millions of dollars, precious dollars, diverted from the kind of care that we all know patients require. There are lots of reasons why this happens, but I think we can all agree that it's not healthy and that the status quo is unsustainable. What's needed is a transformation to a new framework of accountability and sustainability. Not another short-term fix, but a true transformation. Let me tell you how this transformation will begin. I am announcing today that my ministry will provide Ontario hospitals with the $385 million needed to cover the operating shortfall for the fiscal year 03-04. With this funding, we will introduce a new approach of linking funding to achieving desired results. One of the starkest signs to me that we need to improve the way hospitals use their precious resources is found in nursing. Let me describe to you the state of nursing today in Ontario. Only 57% of nurses have full-time opportunities. Meanwhile, there were 2.7 million hours of overtime worked by nurses in Ontario hospitals. Hospitals purchased 2 million of those hours at triple time from agencies. Among healthcare workers, nurses are at the greatest risk of workplace illness or injury. For example, in 2002, nurses filed 1,481 WSIB claims totaling more than 50,000 days of missed work. Nurses are at the heart of our healthcare system, but this precious resource is being squandered. That's got to end. That's why I am announcing that $50 million of the $385 million will be targeted exclusively to create full-time nursing positions and improve the safety and working conditions for nurses. If hospitals fail to reach targets for creating full-time nursing positions, they will lose the funding, and it will be invested in other hospitals that can achieve desired results. We didn't authorize or approve hospital deficits, but we will pay them. The alternative would result in the shortfall being made up on the backs of patients and communities, and that simply is not an option. But this will be the last time this government will do so. From here on in, we're embarking on a new era of fiscal realism. If working people of Ontario can live within their means, it's time the healthcare system did the same. And that comment is not directed only at hospitals, but the entire sector, including my own ministry. It's time a new era of fiscal realism. It's time for that for all of us. I would also like to acknowledge that our government recognizes that hospitals are sitting on $721 million in cash pressures accumulated over the past few years. Quite frankly, I am amazed that this has been allowed to go on for as long as it has. How did we get into this mess? Frankly, there has been a lack of accountability from hospitals and a real lack of leadership from Queen's Park. I'm here to tell you today that those days are over. We are willing to talk to hospitals about the prospect of providing some relief. But understand, if any money is going to flow, there will be strings attached. None of this money, or any other in the future, will flow to any hospital unless it commits and adheres to clear accountability requirements. The accountability requirements are about a new relationship with our hospitals, a relationship that for the first time ties funding to results, rewards good performance, and has real consequences for poor performance. Here's how it would work. The Ontario government, the insurer, would enter into agreements with each institution to ensure targets are set for service delivery and volumes, as well as achieving key government priorities like a higher proportion of full-time nursing in exchange for funding. Like many of you would expect to see in your own businesses or homes, it would ensure a clearer recognition of the contractual nature between payer and provider. It would also ensure that there are penalties for those who fail to deliver on their commitments. It's funny how in some circles this seems like a radical concept. What's radical, I would suggest, is that it's never been done in Ontario before. Government must almost Government must also change its behavior towards hospitals. In the past, the absence of stable, predictable funding has made it more difficult for hospitals to plan effectively, which often contributed to the deficit trap. Having clear rules for how hospitals are funded is an essential part of ensuring that they are given the resources to actually deliver on the requirements set out in their agreements. To that end, hospitals have been working with government through the Joint Provincial Planning Committee on a new, more predictable method of funding hospitals that enables longer-term planning and links funding to quality results. Make no mistake, accountability and predictable funding must go hand in hand. We believe that transformation must begin with making hospitals, the largest component of our healthcare system, sustainable and accountable for delivering results. Now, in fairness to hospitals, I recognize that many of them have been put in an untenable position. They've been forced to pick up the pieces when other parts of the healthcare safety net weren't available to deliver effectively. This has resulted in cost pressures while hospitals expanded services to meet growing demand. Our plan to introduce accountability agreements is not to pick on or to punish hospitals. Instead, it is to bring clarity to the relationship in order to secure mutual benefits to both hospitals and to the public. For too long now, we've been treating symptoms, not causes. A bit like cranking up your furnace in the middle of February, only to discover that the real thing you need to do is close the windows. It's time to take a step back and get our house in order. Therefore, this commitment to predictable funding will be accompanied by an equally firm commitment to investment in the complementary, community-based services needed to allow hospitals to do what they do best. Hospitals are expensive places to treat patients, yet far too many hospital days are taken up by patients who don't need to be there at all. Institutional long-term care and home care supports are two examples of alternatives that can facilitate safe and appropriate early discharge from hospital. Furthermore, community and home supports can help keep people out of institutions in the first place. The evidence is overwhelming that these can be cost-effective alternative approaches. So why are we not taking better advantage of these options? By taking steps to put these community and home supports in place, we can reduce the unfair and unnecessary burdens placed on our hospitals, allowing them to plan their budgets and serve their patients more effectively. Furthermore, by doing this, we can act in the better interests of patients' health and comfort. Before I leave the section on hospitals, I'd like to say something very, very clearly, and I'd like to send a message very specifically to those hospitals in Ontario who year in and year out have balanced their budgets. Some of whom will view our talk of dealing with deficits in 03-04 as a reward for behaviors that they did not participate in. We don't view it that way, but I would like to send the strongest message possible, a message of thank you, a message of thanks to those hospital administrators that have not exhibited those same needs. I'd like to talk secondly about accountability and outcomes. The second change strategy focuses on making our healthcare system more accountable, more focused on outcomes, and more committed to quality care. Often it's been difficult to develop and execute accurate methods to measure our system's outcomes. Things like quality were difficult to judge and difficult to quantify. And even things like wait times were impossible to measure with any real accuracy. We need clearer performance targets, greater transparency, and better lines of communication. It's time to actually transform our healthcare system into a system focused on results. Results-based planning focuses on achieving results in priority areas rather than the scattergun approach of the past. It makes sure that the money we spend achieves measurable and meaningful results that people care about. It gives Ontarians some clear and easy measures to check government's progress and to hold us accountable too. Bill 8 plays an important role in our results-based planning agenda by creating the Ontario Health Quality Council, an independent, arm's-length body responsible for reporting on important health quality indicators to assist us in raising the quality of our healthcare system. The Council would measure the effectiveness of the system and report on its performance in priority areas that Ontarians tell us they care about most. Finally, we're working on a new strategy to create incentives and rewards in the system. allowing us to target resources towards particular challenges. I've talked about how Ontario's hospitals will be required to meet performance goals, including targets for better managing clinical and human resources, namely creating full-time nursing positions. And results-based budgeting will be extended to the entire public health care system. All healthcare providers will be made accountable for how well they work together to meet the needs of patients. Information technology will be a major enabler because it allows health providers to talk to each other and share information. It will also revolutionize our ability to evaluate system performance. That's why we will put health information technology integration in full forward gear. It's an ominous sign for all of you. There are 2 glasses of water. The third area of reform is what I call the transition to community. If there's one basic solution to making care more effective and more sustainable, it's this: putting it into the community. I haven't been the Minister of Health for very long, but one thing I know is that Queen's Park certainly does not have all the answers, and I think it's time we acknowledge that. I'm a great believer in government, and I can tell you that the people in my ministry are some of the brightest and most committed public servants I've ever encountered. But trying to run Ontario's healthcare system from a suite of offices at Queen's Park is a little like trying to shave while blindfolded. You're not quite sure what you're doing, and the risk of slipping up is enormous. What's needed is better integration and planning at the local level so that we can deliver better results in each part of our province. Not a regionalization model, a made-in-Ontario solution that builds on the strength of our community-based organizations, large and small. As Romano showed us, primary care renewal is the foundation on which the transformation of our healthcare system must rest. At its heart, it promises to improve access to primary healthcare services and prevention, and serve as the golden thread that will help weave the disparate parts of our healthcare system together. Our government will move decisively on primary care renewal by acting on our commitment to create family health teams that will provide comprehensive family health services around the clock. This approach will allow physicians to work as part of a team with other health providers rather than in the isolation of sole practice. Physicians, nurse practitioners, and other members of the team will benefit by working together in a positive working environment, sharing and benefiting from the complementary knowledge and skills of their colleagues. And patients will benefit too, by having improved access to a range of family health providers that will care for them when they are ill and help them stay healthy in the first place. The Federal Health Accord allocates money to expanding primary care reform, and we will take full advantage of it. Effective home care services are also very much a part of our plan for putting care in the community. Romano calls home care, the next essential service, and we agree. Nowadays, services that used to be only provided in institutions can be delivered at home. Home care can offer greater dignity and quality of life. Many prefer the independence of receiving care in their home, but for too many, that is not an option. And we know that home care is often less costly. We are too reliant on institutional care. We are going to change that. If what I say about the investments in the community in primary care and home care has a familiar ring to you, this should not come as any surprise. It's been spoken of constantly, but we aren't interested in just talking. As a first step to put care in the community, we will invest the Federal Health Accord dollars this year in home care services, catastrophic drug coverage, and the development of family health teams. This will help us build our capacity to care for people in their communities and integrate community services with institutional care. Finally, let me speak a little bit about the fourth positive change strategy, a more expansive focus on healthy living and prevention. Our goal is to help Ontarians be the healthiest people in Canada. This is a target we can meet, and I'm so pleased that my parliamentary assistant, former Olympian Peter Fonseca, has signed on to help show us the way. But good health means more than being free from illness. It means more than having a bone set properly when it's broken or a wound treated promptly. Good health encompasses a broad range of factors, including nutrition, environment, exercise, disease prevention, health promotion, and health protection. We've developed a good model for treating illness, but we don't have an effective strategy for keeping people well. And we intend to move aggressively to give all Ontarians the resources and the support that they need to achieve good health. It doesn't matter whether you're a senior citizen, a farmer, or a logger. Our goal is to improve your health. To make Ontarians the healthiest Canadians, we will tackle the most high-cost, high-burden, and preventable health issues. These include smoking, childhood obesity, onset by inactivity, and disease. Our government will undertake an aggressive plan to reduce tobacco use, to protect people from the harm of secondhand smoke, helping those already addicted to quit, and preventing our youth from taking the leap to this deadly habit. And on that point, I'm often amazed that I drive by high schools in our province, no longer offering grade 13, and therefore having very few 18 and 19-year-olds in them, to see minors smoking. And you got to ask yourself how this could be. I sometimes wonder, who are their dealers? And what are we doing as a society to stop young people from taking up this most deadly habit? The social and economic costs of obesity are also enormous. Obesity often starts in childhood, and many of the causes and cures are well known. In fact, I've been a poster child for trying to get past something that I've carried around for a long, long time. And I'm still working on it. Our government will attack the root causes of obesity on two fronts: by increasing physical activity and promoting healthier food choices. And we'll do that in our schools, and we'll do that across the broad reach of our society, and government will demonstrate this leadership, but success will take all of you. It will take all of us. Another area we must tackle is domestic assault, not only because it is a reprehensible social problem, but because it consumes a remarkable amount of health resources. As we go about our daily lives, all of us can take real action to help ensure the sustainability of our healthcare system. Just as with energy conservation, choices you make today can help ensure healthcare will be there tomorrow. By choosing to take the stairs or walk around the block, or preventing a teenager from taking up smoking, you can make a contribution towards a more cost-effective healthcare system. It's logical to question how modest sacrifices made by just one of us can possibly make a difference to the survival of publicly funded healthcare. But multiply those benefits by 12 million of us pulling in the same direction, and you will all see that there are significant benefits indeed. And if you need any further lesson on this, look to this young man, Kristopher Knowles, for the active leadership that is within each and every one of us. Healthcare is a $28 billion pie, stretched out across an unimaginable number of boundaries. Boundaries between hospitals, regulated health professions, labor and management, and even religious orders. Let me also come back to an issue I touched on earlier, and that's the issue of money. I acknowledge the inherent tensions in the healthcare system around money. I certainly knew they existed before I took this job, and I certainly know it today. These tensions will always be there, but we can take huge strides towards better healthcare beyond just spending money. I don't believe every issue can be reduced to a showdown about dollars and cents. There are a lot of other resources, a lot of collateral good in our system which can be leveraged. That's the Medicare advantage. The task at hand is a tough one, and it will challenge the status quo. Some familiar and established structures will be transformed, or may even disappear altogether, while newer ones emerge. There are many entrenched interests who may be resistant to change and who may argue against necessary reform. But we must recognize always that we are in this together, and in the end, we will all share in those benefits. I believe our government has provided some real leadership on these issues, and in the coming months, I'm determined to work with you to move forward with the transformative changes I've outlined today. In closing, I would like to leave you with one final thought. A challenge, actually. A challenge to all of you to be part of the solution. A truly effective, patient-focused healthcare system is within our reach. In fact, many of the components are already in place. What we need now isn't simply more money, but a more determined effort to make the various parts of this system work in harmony. It's time to say goodbye to the silos. It's also time for a cultural change, time for a new atmosphere of trust, accountability, and cooperation, an end to the bickering and the turf wars, and the beginning of a new collaborative effort to make this system fire on all cylinders. It's also a job for all of us. Every single Ontarian has a stake in the outcome. Every single one of us has a contribution to make in the transformation of our healthcare system. I say it's time for Ontario to lead the way again. Let's get it done together. Thank you very much.
Thank you so much. Thank you so much for taking time out of your busy schedule to address the Economic Club of Toronto. We're grateful, and thank you. I feel a little guilty now to enjoy our desserts, I think. We promised everybody we have everyone out of here by 1:30. Just let me say that this is a typical Economic Club of Toronto event. If you haven't experienced one before, please leave us your business cards on the way out. If you haven't already done so, we can keep you informed of all future events. We have a number of wonderful events forthcoming. Once again, thank you, Minister Smitherman. Thank you, all of you, for attending. We look forward to seeing you again in the near future.
to 10% increases. And I think that, as I said in answer to Richard's question the first time around, this is not new news. We've been working on this with the Ontario Hospital Association very closely, and I'm very, very confident that they're ready to take up the challenge. That there is a new sense of partnership emerging. You see it all over Ontario and travel. There is increased commitment to getting healthcare providers and local communities working together in a complementary way. And to deny it would be wrong. I really encourage you to get out there and look for it. I've had tremendous opportunities to see it in Northwestern Ontario and Southwestern Ontario. I'm going to Ottawa this weekend where there's been some really extraordinary stuff done. So the healthcare. You see, the focus on punishment and the like, I think, is a bit misplaced, because we're going to sign off. We're going to have a very mature relationship here, a move to a very mature relationship, which is. When you ask me, you might want to listen to me. That we're going to sign off on this in a way between the hospitals and the Ministry of Health. This is a new relationship. It's a contractual obligation, and rather than focusing on the penalties, I'd rather focus on the good behavior that it's going to promote.
10% is unsustainable. What are we talking about reasonably?
Well, the budget, the finance minister is going to have a lot to do with it, and we'll have to wait. We'll have to wait for that number. But I think in my speech I gave the clearest signal that I'm able to give, which is to say that we recognize that hospital budgets will grow, and that the rates of growth need to be predictable, but that they won't approach the double digits that are there now. And the finance minister's budget will give us that number on a going forward basis.
How many hospitals survive
The $50 million is not about hiring the 8,000 new nurses. It's about stabilizing the existing system for nursing in this province. I have been clear on this. I have said repeatedly, and I will say to you very clearly now, that the current situation, the foundations of nursing in this province must be rebuilt. And our first priority is to improve the circumstances for those nurses that are in the system now. They are being worked to death. They are being prevented from exercising their full opportunities by being given full-time employment. We make this as a first priority to improve the foundations of nursing, to get past this situation where nurses are having extraordinarily high rates of workplace health and safety problems, and that's my first priority with respect to nursing. Change the foundations, rebuild the foundations, and improve the situation for those thousands and thousands and thousands of nurses that are in the system now and being deprived of the full-time opportunities to provide stability for our healthcare system and stability for their lives as well. The 700, what we acknowledge in the speech from the people should be reassured.
The federal health support money, how much is that?
I think right at the outset, would be ill-advised to do so, but way more importantly than that, what I'm incredibly strengthened. All right.
And that he was making a priority. And I'm actually glad that he said something, and I'm glad what he said in his speech and everything, and how he said it, and how he wanted to make it top and all that. Just so happy for that.
Are you excited? How do you feel being singled out as being his hero? And being a hero for Ontarians and for Canadians?
Oh, I feel that's great. He's my hero, he's my friend, and that's why one of the reasons why I came up and dressed up like this. And I'm just glad that
So do you think that people can really make a difference? Every single person, he said 12 million Ontarians can make a difference, each and every one of us, just like you, and you're an example to everyone. Do you think that's true? Do you feel like you're an example?
yeah, I do think it's true, I do think I'm an example, but there's other examples out there, not just me. Like all those 4,000 people that are on the list right now, there are other examples as well.
Do you think people should be doing more?
Yes, I think there should be way more than just doing something. They should do more than they already did.
Thanks. Okay, you guys going to be here for a while? Like, are you leaving? When are you leaving?
I think we're leaving
Okay. So
Dr. Smitherman said something about the issue of organ and tissue donation. I'm glad he's going to try to look for it and make it a number one priority. And I'm just very thrilled that he said something about it.
Were you disappointed at all with anything that he said tonight? Or was this what you were expecting?
No, I thought this was what I was expecting, and I'm at least glad he said something instead of not saying anything. But I'm very glad that he said something.
And what's your big goal for, like, ultimately, what do you want to see the health ministry do?
I want to make them see everybody, like George said, he wants, like, when everybody's born, they're getting put on the list already. And then when you're 18, if you want to get taken off, you can get taken off. But see, if you, like, die between that age, you have to donate your organs no matter what. And I think that would be way better than just have to sign that card and then your parents have your final consent. So I think it'd be easier the other way instead of signing the card and just telling the family you don't have to, you're already on the list.
Excellent answer. Anything else you want to say?
Well, my usual sayings. Please don't take your organs to heaven. God knows when you come here. And please tell your family and friends to sign those cards to save the 4,000 men, women, and children that are lost.
I see it. Got it. Right.
Well, we're hoping that you can help us. We're not sure yet. We're hoping that they can take part in this. It's not a cause to take part in this. That he asked me to work with. I've had about 20 operations to save my life.
Too cold out there for me.